Hello, I'm Angela. Thank you for taking the time to learn more about your Medicare coverage. I know from my own experience as an independent health insurance broker that there is a lot of information to learn about, and it can be very confusing and complicated at times. That's why I'm starting here with the very basics. I know that once you understand the basics, you'll be more confident in your choices. So let's start at the very beginning. What is Medicare? Who can get it? The parts of Medicare, what the parts cost and cover, and how those parts work together. Medicare is a federal health insurance program for people 65 and older, and for people younger than 65 with qualifying disabilities. You also must be a United States citizen or legal resident. If you're a legal resident, you must have lived here for at least 5 years continuously, including the 5 years before you enroll in Medicare. Another thing you need to know is that Medicare is individual insurance. That means that every individual person needs to qualify for it themselves, enroll in it, and choose coverage for themselves. This is probably not what you're used to if you've had family coverage, say, through an employer in the past. So Medicare is made up of 3 parts: Part A, Part B, and D. Part A helps cover your hospital, skilled nursing, home health care, and hospice care. Part B covers your medical expenses like doctor visits and durable medical equipment like wheelchairs and hospital beds. Part B also covers many preventative services like screenings and shots and vaccines. Part D helps cover the cost of your prescription drugs. Part A, B, and D help to cover the costs of Medicare, but they do come with certain costs such as premiums, deductibles, and co-pays. Let's start with Part A. Part A is free and does not have a premium if you or your spouse have worked and paid taxes in the United States for at least 10 years or the equivalent of 40 quarters. Although Part A does not have a premium, it does have a deductible of $1,632. That's for 2024. That means you're responsible for $1,632 if you're hospitalized. With Part B, you'll have a standard premium of $174.10 for 2024, and you'll have a higher premium if you're in a higher income bracket. You can refer to the link below to check what bracket you're in. If you're taking Social Security benefits, the Part B premium will be deducted from your Social Security. If you're not taking Social Security yet, then you'll need to pay Medicare directly for your Part B. Part B also has a deductible of $240 for 2024. Again, that means that you're responsible for paying the first $240 for your medical services for the year. Part B also has a 20% coinsurance cost as well. That means that you're responsible for 20% of any medical services, and there is no cap on that amount. This is why adding a Medicare supplement or enrolling in an Advantage plan is recommended. Now, your Part D is your coverage for prescriptions and offered through private insurance companies. And those companies are required to follow the rules set by Medicare. There's usually a premium and a copay for medications. Now that we've gone over the parts of Medicare, parts A, B, and D, we can go over your 2 different choices for getting additional coverage to help pay for the costs of Medicare. You have the choice of keeping original Medicare and adding a Medicare supplement and a prescription drug plan, or you can enroll in what's called a Medicare Advantage plan. An Advantage plan combines your hospital, medical, and prescriptions together into one place. Now, if you enroll in an Advantage plan, you should be aware that Advantage plans are offered by private insurance companies. In most cases, you can only use doctors who are in that plan's network. And in many cases, you may need to get approval from your plan before it covers certain treatments or services. These plans may have a lower or higher out-of-pocket cost than original Medicare, and you may also have an additional premium. Medicare Advantage plans may offer some extra benefits that original Medicare doesn't cover, like certain vision, hearing, and dental services. There will also be co-pays and maximum out-of-pocket costs that you will need to pay before the insurance company pays. Your other option would be to keep original Medicare and add a supplement and prescription drug plan. If you choose this, keep in mind that Original Medicare includes Medicare Part A, your hospital coverage, and Part B, your medical insurance, and your supplement will help pay your out-of-pocket costs. For example, the 20% Part B coinsurance. The main reason people choose a supplement over an Advantage plan is that you can use any doctor or any hospital that takes Medicare anywhere in the United States. Whereas if you have an Advantage plan, you must use the doctors and facilities that are in that Advantage plan's network. Another important thing to consider when you're making your decision on whether to enroll in an Advantage plan or a supplement is that when you're first eligible for Medicare, you have the option of choosing a supplement without going through medical underwriting. During your initial enrollment period, Medicare does not allow health insurance companies to ask you any questions about your health. However, if you initially enroll in an Advantage plan and then decide 3 years later that you'd like to enroll in a supplement, now the health insurance companies can put you through medical underwriting. And now they can deny you coverage based on your medical history. Now, you're wondering, what exactly is medical underwriting? Medical underwriting is the process of evaluating an application for health insurance coverage by examining the applicant's medical history. For example, if you're a smoker or if you have certain medical conditions, the insurance company can deny coverage if they choose to. I hope this information has been useful in helping you understand the basic mechanics of how Medicare works. Please reach out to me with any questions you have. My contact information is in the link below. And I also recommend that you visit Medicare.gov. This is the official federal government site that I recommend for information about Medicare. I just want to thank you again so much for watching my video today. Look, Medicare can be stressful, I get it, but what I want you to know is that you have someone you can trust in me. If you have any questions, please don't hesitate to reach out to me. There are no dumb questions, and I'd be happy to hear from you and answer any questions that you have. Thanks so much.